In this episode, we're talking about testosterone replacement therapy. If you're thinking about getting it, or if you know someone who does, we're going through some of the pros. Obviously, there's a lot out there, but also some of the cons.
Yeah, and ways to boost your T naturally. If you don't have your health, what do you have?
You are a functional medicine doctor.
Join us as we blend modern and ancient wisdoms to be well now.
Welcome to the Be Well Now podcast.
Hello, everyone.
I'm Nick, the Curious Patient.
And I'm Dr. Ron Dummar, functional medicine doctor, Chinese medicine doctor, and the owner of Community Health and Wellness.
In Heber City, Utah. Link down below. Today we're talking about testosterone replacement therapy, TRT.
Yes.
And whether you're someone out there who's considering this, we have a lot of women listeners, so maybe your partner's thinking about this, send them to this podcast because you're not philosophically against TRT. I feel like I have at 37 a lot of friends who have started to take it, and I feel like I want to know more, right? So you're the guy that I'd like to learn more from about testosterone, TRT.
Well, yeah, and it makes sense that you would have people around 37 that would start thinking and gearing themselves towards taking TRT. And the reason for that is that the body does naturally around the age of 35 begin to reduce its natural production of testosterone by approximately 1% each year. So overall, if you're 35 plus, it's very likely that your man has a reduction in testosterone year to year.
So testosterone's a mood boosting hormone. Mm-hmm. I was listening to a podcast recently where the guy was like, men want to feel happy or happier, healthier, and harder to kill.
Oh yeah, for sure.
And if testosterone,
you want to feel robust.
Yeah, we
want to feel strong. We're men. Yeah, we have to stand in front and take the fire, right? Take the insult. And I often hear women say too, "I want to be fought for," and I think that men feel that, right? We feel that, we know it, whether it's a psychological thing or it's a physiological thing that's communicated, we feel that and we want to fight. We want to be strong and robust so that we can stand up and fight for our families, for our women.
Yeah, and the more we become technologically intertwined on phones and things become less tangible, it's the information age, I think the more there's a movement of guys who just, and gals, everybody, want to feel primal again, right? That they can
connected. I think there's a connection,
so?
A really raw connection that people are looking for.
Okay.
They want to be connected with each other. They also want to be connected with the world around them. People are looking for tribe, right? They're looking for a group of people that they connect with.
Well, I don't know why
that they resonate.
What
with.
about that sense of wanting to feel like a sense of your own tribal ancestral physicality, right? I don't know. As a guy, I just have felt a desire to tap into that a little bit.
You want to connect with the caveman.
Yeah, man. Mm-hmm. Let's get primal.
Give me my bat.
Let's eat only raw red meat and just fight a lot.
Yes.
Okay. So testosterone, TRT therapy.
Yeah.
Right? Improves sex drive, helps you recover faster, makes you stronger, more energy. There's a reason why this is the craze now.
That's why people want to take it.
And we want to get into, first of all, does it make you stronger, testosterone?
You know what? I would say it does. It can, right? You look at what happens between the ages of 10 and 14 years in the maturing age for women and men. And you start having that increased or that boosting of testosterone production. And that increases the muscle mass production. There's not a real significant difference in muscle mass before those ages between men and women. But as soon as that testosterone starts to jump up, then the increased amount of muscle density or the muscle mass is pretty significant. And so, yes, it can make you stronger. It can even improve bone density.
It can?
Right? Absolutely. In fact, this is one of the reasons that people will take T as they age or later in life to reduce the risk of fracture, hip fracture specifically.
I could totally see why you'd want to not have that happen because falls are, you see it, right? Elderly patients, and we've all had family members. The fall is what happens before the next cascade of pneumonia in the hospital and passing away.
It's often lung issues or a clot that they're concerned about when you have a hip fracture. And that's typically what people pass from, right? as they age is a fall that leads to other issues. Now, one of the other things about T production is it helps and influences the brain. I don't think there's a lot of focus on this for people, but it also does help you to focus, helps you to concentrate, and to dial in and accomplish tasks. And so it helps you to do that, but it helps you to feel good about what you're doing at the same time. And the reason it does that is because it releases the production of dopamine. So dopamine becomes more active when we have more adequate levels of T in the body. And if you think about working out, doing that high intensity interval training, or going for a good quick run, right? After that activity, you feel a surge, right? You feel the surge, you feel this reward after it. And that reward partially comes because of the dopamine that's being released in response to the elevation in testosterone in order to increase the bone density and the muscle mass.
Okay, so I do think we want to get into some possible cons.
Yes.
We also want to talk about other supplementation, hypothetically, before you would do. I think a lot of people would like to stay natural as long as possible.
Well, and I
think
that's the idea.
Before they get a synthetic injection of testosterone?
Absolutely. Well, and even if it's bioidentical. So this bioidentical idea that people hear thrown around a lot, it's claimed to be, and the idea is that it's identical to the hormone, the compound of testosterone in your body. That's why they call it bioidentical, is because they're saying it's identical in structure to the hormone that your body makes.
So it's not synthetic testosterone? I just made that up. I don't know if that's...
Well, it's produced, it's made, right? And it's synthesized still, and it's synthesized outside of the body. So we would call that exogenous, outside the body. So that's synthesized outside the body, and you're going to introduce it to the body from the external source.
Is it from yams or something? Where is this testosterone?
So they get it from plants. Typically, they'll derive it from a variety of different plants. Mm-hmm. And so that is an exogenous source. So it's not necessarily like petrochemicals. Often when we talk about medications or drugs, they synthesize them from petrochemicals. There's not necessarily a petrochemical route, at least that I've seen. I could be wrong on that, and maybe one of our listeners will correct me. But they tend to synthesize it from plant products and compounds. So testosterone, though endogenously, meaning produced within your body, is produced in a variety of different places as well. And so the management of testosterone is controlled in a very specific way within the body. And so maybe what we're going to be getting into as well is how do we determine whether or not we even need to be addressing our testosterone?
Yeah.
Right?
But I also think we should talk about side effects and why you wouldn't want to take. I interrupted you. Sorry. I'm just trying to think if I'm coming into you, I'm like,
well, for the
hey,
first,
doc, I think I have low T. What
exactly. So what are you going to feel?
Yeah.
I think, let's say, what are you going to feel if you think you have low T? If somebody comes into me and they say, I think I have low T, well, first of all, you're probably going to feel lower energy. Okay. You're going to feel like maybe you're not getting the gains or the shaping or the tone of the muscles when you work out. You're like, hey, I'm working out, I'm not losing weight, or I'm not able to tone and shape like I thought I would, or I feel like I should be able to, or I did previously. It could be I'm feeling moody, like I feel down and depressed. It also could be that I'm not able to achieve an erection, or I'm quickly releasing, or I have essentially a short duration erection, right? Those are a variety of different things that could lead to a person coming in and suggesting, hey, I think I have low T.
Okay. So then what?
So then they come in and we say,
they get tested?
Then we have to say, okay, well, let's determine whether you do or not, because is it really from the amount of T that you have in your body, or could it be something else that's affecting that? And even if your testosterone is low, and let's look at this, what is the range that you would like your testosterone to be in? Typically, I look at between 300 and 1,000. Like if you're below 300, that's definitely that's definitely time to be considering taking measures. I would say herbally at first, if you haven't already, exercise, a variety of different things that way as well. But you have to take measures to correct that. Okay.
Some of those would be supplementation, sleep.
Supplements, sleep is a big thing, definitely, because cortisol is released in the morning to help you wake up, and the regulation of cortisol and our sleep-wake cycle plays a significant role on the production of testosterone. So you really, if you want to have proper and adequate testosterone production, you really need to be getting a minimum of 7 hours of sleep. So factor in for yourself 7 hours of sleep minimum. Getting a good night's sleep is critical to testosterone production.
Okay. And then obviously stress is a huge part of it as well.
Yeah. So the cortisol that we mentioned, that's what gets you up in the morning. It pushes sugar into the bloodstream. It opens your eyes, right? You're like, okay, I'm ready to go. But the cortisol is also a stress hormone. So waking up in the morning and being able to feel alert and awake and ready to go, you actually want that. That's a healthy cortisol surge, okay? But some of us have continual surges in testosterone because we've dealt with traumas. And we're
testosterone or cortisol?
Sorry, cortisol. Thank you for correcting me on that. Some of us have continual surges in cortisol because we're struggling with resolving trauma, or we're going through a very, very difficult life experience. It could be a crazy divorce or a death in the family, right? Some of these traumatic events, or it even could be some PTSD, post-traumatic stress, that people are experiencing. And these will significantly lower the testosterone. Here's the other thing, that some women find themselves in a relationship with what they call a workaholic. So certain men will push themselves so much. They're willing to push themselves. They put themselves in these really, really high stress, high stake environments. The cortisol surging. They're pushing, high demand. And then they find that their partner, who's this workaholic, is all of a sudden not really interested in them or in intimacy. But they're really focused on their job. And so even the stress level, the overabundance of their focus on their job, and if it's a highly stressful job, can impact their relationship, and essentially can impact their production of testosterone.
Well, I want to give people a roadmap then. So let's talk a little bit more about some of the things that can lower T, then a risk if I'm not in the low range of using it, which organs impact your T production. And then also I do want to talk about some possible reasons not to take it. I know we're all over the map here.
So some things to stay away from.
But what else causes low T? Because I know that when I got my blood tested here, you're looking at every marker and you're using your experience and expertise to create a story of what could be going on, right? What organs are talking to, this is your world, but there has to be, you want to know what's going on up and downstream that could be causing T to be low. You're going to try to address that. Overall health, metabolic health could affect your T if you get other things in line, right? And that's from blood tests, that's from consulting with you. So again, this is for the guys out there, or the people who have a partner who's thinking about this. This is the conversation you want to have before you just get the injection, right? Why not spend a little bit of time? Because once you start on TRT, from all the research I've done, is you're probably going to be on it for the rest of your life. Like, it's probably like, why would you not? So it's kind of a lifetime commitment. It's worth putting in a little bit of thought and effort.
Absolutely. And it would require a significant amount of work to wean off of that.
Yeah.
And I believe as a purist, right? I believe it could be done. I just think the mechanisms of the physiology and the way that it works within the body, and the actual fact that you're replacing a function that is meant to occur within the body, not stimulating that function to occur, becomes the problem. So that you're no longer efficient at secreting and producing T because you're just replacing it. Okay. So how do what lowers T?
Yeah, let's talk about that.
So a lack of exercise, lack of activity, lack of proper diet, food. So if you're eating a high sugar, poor fat quality diet, breads, pastas, candies, cookies, cakes, donuts, all of those things are testosterone killers. Okay. Those are testosterone killers. So also, if you're having overexposure to certain chemicals, endocrine disruptors is what we call a lot of these different chemicals.
Is there one example where a lot of people have exposure they could readily get out of their diet or experience in their lifestyle?
Potentially, if you're in a
plastics
place,
are everywhere, man. Like
plastics, exactly.
I just had this grass-fed beef stick and it came in plastic.
Wrapped in plastic.
Like, what are you going to do?
So, and you have to really look at, a lot of us are into water bottles. Water bottles are it's such a convenient source of storage and transport, right? But it's plastic, right? It's stored in a plastic bottle. And so if you can reduce your exposure to plastics in general, then yeah, you're going to have a better outcome as far as your production of testosterone. It's interesting because I think they've said that between the 1940s and today, there's been an overall 30% reduction worldwide in testosterone levels in men. So from the information that they've been gathering over time, in the 40s, men had across the board a 30% higher amount of testosterone in their blood than we do now. So there are also other chemicals, so phthalates, PCBs, dioxins. These are found in a variety of different, flame retardants sometimes, or carpet, like stain removers. Like you have stain-resistant carpet, the chemicals that they use in there. It's a specific chemical, but it can cause endocrine disruption and influence T production. Also, your nonstick pans. If you got nonstick pans, you're using nonstick pans, you're using, essentially you're exposing yourself to chemicals that are going to disrupt your body's ability to properly balance. And that goes for not just men, and not just testosterone, but also for all your hormones.
I tried going nonstick, but the pan is so nice with the eggs in the morning.
Yeah.
I can flip it. Like, try doing stainless steel eggs where you flip it and it just gets stuck.
Convenience.
Yeah. I don't know. But we live in the modern world.
And you want to use a really good quality fat, right? A really good quality oil for the cooking. If you choose to do that, if you use a good stainless steel pan, other patients, they're using cast iron pans, but you also want to be careful with that because sometimes your iron levels can get too high as well. We do see elevated, significant amounts of elevation. You do win by acknowledging that there are a variety of different things that can affect your body.
Yeah.
And you balance out your exposures or try to minimize, like plastics, for instance. Those are things that we actually can reduce in very specific ways, right?
That makes sense.
So it's like, am I willing to get rid of or part with all of my nonstick pans? No. Well, maybe I'll keep one nonstick pan that I use for eggs.
That's it.
Right. And maybe everything else I cook, right? That's a good, right. And I mean, would it be better to say, it might be more of a purist sense to say, I'm not going to have any nonstick pans at all. Right.
It's miserable.
Yeah. So
try cooking over easy eggs on stainless steel. I've done it. Yeah. It doesn't work well. You got to clean it. Anyway, it's a lifestyle thing, but maybe we'll talk in 10 years if something goes on with the nonstick and I'm coming in with a disease that you're like, shouldn't I use the nonstick?
Yeah.
But we also talked about you can get so stressed out about all this stuff that it increases your cortisol. That's what I'm saying. So it's like,
well, don't be such a purist, right? That it's like your stress is so high and you're like nitpicking every single thing and you're just worn out because then you begin to build up this idea in your mind that everything's attacking you and disrupting your state of mind. And then, it becomes really a mental battle at that point because you literally feel like the world is out to get you, right?
But our bodies know what to do, right?
Oh,
they have a natural wisdom. Your organs body, talk to each other.
Our bodies have been adapting for millennia, okay? And that's not a reason or a justification to expose yourself to forever chemicals, okay? But what that is it's something to take to heart and say, I am capable of being healthy, of achieving wellness and living vibrantly. And I don't have to become a zealot to do that.
Which organs then impact your T production? Like, let's talk about up and downstream. You're doing an analysis. You're creating a story for a patient. They come in with low energy. Let's say they have low T.
Yeah.
Now you're going to give them a different answer than maybe they would get at the men's clinic.
Yeah. So people come into me a lot and they say, okay, especially right now, hormones. They say, doctor, I think I need my hormones checked. And I'm like, okay, well, why do you think you need your hormones checked? Right. And, low energy and, difficulty losing weight and maybe some GI related issues and, maybe some hair or receding hair or whatever. Right. And a loss. So they look at that and they say, well, all of this seems to point to hormones. And usually this is women. Women will say, it's my hormones. And I feel like that maybe we've been unfairly treating women and just pushing everything off on hormones. Okay, so hormones can have and do have a significant impact in our lives, and we should make sure that they're balanced. But the question really is not, should I be going to somebody to say I need my hormones balanced to replace the hormones in my body? What we really should be looking at is saying, what's going on? Because I know my body produces hormones and I know it has the potential to balance my hormones naturally. How can I do that? Or is that possible? And in certain cases, I would say in most cases, 90% of them, it is possible to get yourself in a situation where the organs of the body are actually producing and secreting hormones at the right balance for you. In certain instances, you may actually need to do some hormone replacement. Regardless, but
and that comes through blood tests where you do analyze what's going on
exactly.
in the body, right?
This
isn't watching a video and just taking a couple of supplements.
No, okay. Absolutely not. It's looking at, okay, do you actually have an imbalance of hormones, and then why do you have an imbalance of hormones? So what produces the hormones, the sex hormones, the androgens and the estrogens? Most people will say automatically, oh, the ovaries, right? Oh, the testes. So the testes and the ovaries. Okay, well, sure. But what about before his testicles dropped and her menses started? What initiated that process? How come she didn't come out of the womb menstruating? Something's guiding it, right? Something is initiating that process to occur. And that is hormone regulation within the body. It's hormone stimulation within the body. So these organs that do this are the adrenals. And in Chinese medicine, I would say the kidney is involved in that in a significant way. So kidney and adrenals, the pituitary and the hypothalamus. So these organs, these glands play a significant role in the production of and the stimulation of the production of hormones.
So you're going to work on supporting those.
Exactly.
Through some of these supplements or possibly not even these, but in other... I watched a lot of videos about this and no one talks about it this way, right? It's not as sexy to discuss the more holistic approach to it. It's like, what are the things that this can help and how much do you take? And
can it be beneficial and what are the risks? Right. Yeah. I mean, that's kind of what people say and looking online. Yeah. That's the information they give. But what people really want to know, what they need to know is why is there a dysfunction in my hormone production? Well, there's a dysfunction because the stimulation to produce the hormones that you need in order to be balanced is not happening or not happening adequately.
And why is that not
happening? So let's jump to thyroid for a second. Okay. Thyroid's it's an organ, right? That a lot of people look at and they say, okay, my thyroid, I have low energy, I'm having difficulty gaining or losing weight, hair issues. I think it's my thyroid. So look at that thyroid, say, okay, what's happening? Well, there's thyroid stimulating hormone. Practitioners will generally order a TSH or a thyroid stimulating hormone on its own. They'll order that analyte on its own to check on the health of the thyroid. So really what they're checking is whether or not the pituitary is sending out a signal to stimulate the thyroid. Okay. So if that signal is high, like really high, or if it's really low, then they go, oh, there might be something here. That's why you look at TSH. But looking at TSH only is also problematic because there may be other things going on within the thyroid itself. Like there may be an inflammatory disorder, or there may be a chronic infection that's affecting that. There may be inflammation that's affecting the production of thyroid hormone. And all of these things can actually affect the production of testosterone and estrogen as well.
So people are coming in not even knowing that could be going on in their body, and they're just like getting shots of testosterone, TRT, and it makes them feel better, but they're not addressing
the inflammation, the causes of inflammation in their body. They're not, I mean, think about breads, pastas, candies, cookies, cakes, sugars, processed sugars, alcohol.
We live in Utah. Don't forget, people like to drink. Like,
yeah,
it's a thing.
And these things like alcohol
not to demonize them. I know you're out there, like, I have family, friends. I know just people like to have, it's the holidays, people drink.
What do we usually say about people who drink alcohol consistently throughout their life? What do we usually call this increased belly?
Beer belly?
A beer belly, yeah. Right? It's like, oh, you have a beer belly. Why do we call it that? Why do we call it that? Because alcohol literally, it plays a mechanism where it pushes testosterone to convert into estrogen. Okay? So now, drinking moderate or small amounts of alcohol on occasion are not going to lead to this. But drinking consistently will lead to elevated amounts of testosterone converted into estrogen, which then makes you gain weight, especially in the belly.
Yeah.
Okay? So if you want to do some things to help your T, reduce the breads, pastas, sugars, the alcohol, those things that convert quickly into processed sugars. But one of the things about alcohol too that you have to pay attention to is that, and a lot of people don't consider this, where are you getting your alcohol from? Where was it grown? Did they use pesticides, herbicides? Have they used chemicals in their production process? Do they use leaching products, right? How do they process this alcohol? And is there possibly some sort of residue left in the final product? How could there not be?
Not all booze is created equal.
Not all booze is created equal.
Is there
I like that. That's a good tagline.
Is there one kind of alcohol that's going to have the least amount of?
You're asking the wrong person.
All right.
But I would say look for as organic and grown and produced product as possible. And look at the company, call the company, ask about their standards, their production standards, what kind of things they add to the alcohol, if there's perfumes or anything like that as well. All of those little additions are going to be chemicals,
plastics. Think people are really going to do that kind of research before they have?
No, but they should.
Yeah,
I mean, they can.
So
it's a recommendation.
My head is our heart is with the person out there who's still thinking about getting the TRT, right? So I want to know two more things. What are the side effects if I get it?
Yeah.
And then what could I do to boost it naturally? I know the blood test and all the, stimulating of the organs up and downstream is a very important part of the process. You have supplements on the table we haven't addressed yet. So let's talk about.
We'll get there.
Maybe some of the downsides of TRT.
Sure.
Because again, you're not against. I think for me, like the injection thing is like the last thing I want to do.
Sure.
And I feel like philosophically I'm opposed, but there are a lot of people who get on it after trying everything naturally and it's helpful for them.
Well, there's a lot of ways to get T, right? So you can, and I don't mean just naturally or synthetically, right? Or endogenously or exogenously. But what I mean is actually the delivery mechanism. So it can be through injection, or it could be gel. There's an intranasal gel. There's also a topical skin cream. You can also have pellets that are time-released pellets that are inserted. So all of those come with a variety of different mechanisms in the body and have different effects. So the research and the studies that I looked at, any potential negative effect, sometimes people would mention it increases the oiliness of the skin, which then can actually increase acne. Pustule formation, right? And so that can be problematic for people. Oftentimes when they do start T production or T replacement, they notice that they break out, okay? Hormone replacement therapy for women, younger women who are brought in with acne complaints are often placed on hormone replacement therapy or hormone therapy in general, or and anyway, they're placed on hormone therapy to help with their acne. Okay, so in this case, tea is actually something that can cause the acne. It can also have an impact on your blood product. Okay, so it can initiate a little more cloying or increase the hematocrit with the overall blood production or red blood cells within the blood, which then can lead to a higher amount of blood volume, and it can lead to a little bit of viscosity or thickening of the blood. And this can...
Clotting? Is that an issue, right?
Exactly. So I would say for the most part, the majority of the recent research studies have minimized or diminished the impact of the cardiovascular system. The impact to the cardiovascular system of testosterone, it seems to be really welcoming to testosterone. But there are definitely studies that have been done previously that have mentioned things like prostate-specific antigen being increased or inflammation.
What does that mean?
So what that means is that there's inflammation to the prostate and potential development of hyperplasia or enlargement of the prostate. So those things are possible. Is it likely to say, okay, this is going to happen? No, but those are things that have been reported in research studies, and so I think it's important for people to have an awareness of what certain possibilities are. Other things that when you take tea, some people can experience impact on the liver, especially if they're taking like an oral pill form of tea, because there's different phases that the liver goes through in detoxification and the formation of testosterone. And so if in certain cases the injection is better, depending on what issue you're looking at. In other cases, the topical is better. The one that seemed to have the least impact or the least nefarious effects were the intranasal gel and the topical creams. So if that's helpful for you.
I can't imagine like putting a cream on though if you're married and then you're going to bed with your significant other. Like you don't want her getting the testosterone.
Absolutely.
So it's like that was one thing I heard in a podcast.
It's called rub off.
Yeah, one thing I heard in a podcast. That's why he does the injection, and he was actually a big influencer in the physics. Like Mark Sisson, the Primal Kitchen, Mark's Daily Apple. I used to read that email, and he was a very like primal, natural guy. And he's 69. He's been on TRT since he was 63. Mm-hmm. And I was like, wow. So maybe just being like a for or against, or it's not natural, I don't want to do it. It kind of opened my eyes to like, maybe there are good reasons to take this at some point once you've exhausted all of the other stuff. But I mean, I would want to do all that first before.
Absolutely. And I believe he did. I mean, in his life and his work, and that's something that he's really put a lot of time into. And so I think it's important that people recognize we're not advocating for one or the other. We're trying to give you information. I want to give you information so that you can be more educated about the decision that you choose to make. And when the right time is as well for you to make that decision. So in this case, as we age, we've already discussed your bone mineral density can decrease, and also your muscle mass can decrease in significant ways. So if you're doing all of these things, you're eating really well, you're managing your stress levels, you're getting therapy, you're breathing techniques, and you've done supplementation, you've worked on your nutrition and everything, right? And you're still noticing muscle wasting and bone mineral density depletion, like a DEXA scan or something shows you that, then, hey, it might be time. It might be time. And that's okay. It's okay to say, hey, I've pushed the envelope. I've done as well as I can, and I'm going to continue to eat healthy. It's not like, I'm going to go on tea and now my diet's going to go to crap because now I don't need it. No, it's like you don't need to continue to be healthy, continue to work on optimal health, continue to push yourself in your optimal way of living. And as you do that, then you're going to support your body as well as possible. So you'll reduce your likelihood of having any of those nefarious effects that we talked about.
Can we talk about the supplements on the table here?
For sure. So I do have, because of some of the blood or heart-related issues that I thought might be mentioned, I do have here a product that we use a lot called Nurse Blood, and it helps with keeping the blood product thin and moving. In Chinese medicine, we look at different organs that regulate the blood product and keep the the nutritive fluids moving appropriately. And this product will help with that. Obviously, a nutritive fluid, nutrition's being carried through your blood everywhere into your body, all your cells. Okay. So Nourish Blood's a really good one if you're deciding, hey, I think I want to go on tea, and what can I do? What can I do to actually protect myself a little bit more, even though I need to be on tea right now? Okay. Here's another one. This is Tongkat Ali. Tongkat Ali has been shown in some research to increase testosterone production in men, to improve mood, and to actually improve sleep. So better sleep, improved mood, muscle density as well.
Okay.
Muscle mass. It's been shown to improve that as well. So Tongkat Ali, I like that. We use that in the practice here. Sometimes men, we've used this with fertility as well, where we have couples who come to us and they're like, hey, we want to get pregnant. We've been trying for a while. We don't want to do IVF or ICSI or anything just yet. So can you help us get pregnant? And so I always call it's a two-way street, right? It's not just one or the other. It's not just him or her. We've got to treat both couples when we're dealing with fertility. And so that's why we do that for the men as well. We also have Testo M. Testo M is a product that I created myself, specifically for male performance and male enhancement. Okay, so it's this will increase your muscle mass. This will help with bone density. This will help with hormone balance in general. This will help. I have in here yin yang huo. I just wrote down some of these names. I learned all of my herbs in Chinese because I went to traditional Chinese medicine school. So I found that it's actually really helpful for people to hear them in their either common name or in their scientific name. So yin yang huo is a herb that we use a lot. It has a lot of metabolic activity, and it supports the kidney and the adrenals a lot. So you think a lot of the activity that is run throughout the body is stimulated through the adrenals and the kidney. This is horny goatweed for those people who are familiar with that, right? Yin yang huo, horny goatweed. Okay, Lu Jiao. Lu Jiao is another one. That's actually deer antler, or the velvet deer antler. Velvet.
I feel like I've heurt of deer antler. Yeah. For sex, supplementation or whatever. I've heard of that. Yeah. Yep,
absolutely.
Sex drive, whatever.
And so it will help with testosterone improvement. And a lot of people are using deer antler now. Like you may have heard of the supplements Bucked Up. Bucked Up is a big brand now out there.
I've heard it somewhere.
You're welcome, Bucked Up. You're welcome for our little shout out. Yeah. But Lu Jiao is a deer antler. We've been using deer antler long before Bucked Up came on the scene. But Bucked Up is doing a great job with all their advertising.
It's called marketing.
Right
Yeah. So, you might want to change all this and just
put deer antlers on there. They might sue us. So anyway, Dujong. Dujong is another one. It's called Eucomia. Dujong helps with the kidney and the liver. It's a strong tonifier for the kidneys. And then another one, Bajitian. These are all going to focus in the liver and the kidney. They're going to focus on the kidney and the adrenals, and then they'll even focus on helping that the hypothyroid. Okay.
The takeaway here, I think, is like a quick fix is so enticing, but like get yourself an appointment with Dr. Dummar or find a functional medicine doctor you trust. Like spend the time and money, I think, investing in the bigger picture to build the foundation for the rest of your life.
Absolutely.
Because I know how enticing it would be to just have more energy now, and it probably works, right? And that's the thing, but what are we not addressing that could lead to a better life?
Yeah.
You had one more supplement. This
is one more that we like to use. I like to use it in combination with some of these others because I think of it like a delivery system almost. This is citrulline and arginine. Citrulline and arginine actually help to improve nitric oxide production in the body. This can open up the vessels, deliver more blood throughout the body, so you get more nutrient flow, right? So if you're putting nutrients into the body and you want those nutrients delivered to the body, improve your nitric oxide, dilate the vessels, get the blood out there into the body. So some other things that might be possible or beneficial, I put this one in for you. It's called chrysin. Chrysin is it's an amino acid found in honey. It's found in plants, but it's found in honey.
Love honey.
Yeah. So
check out our latest podcast, by the way.
Yeah. I mean,
honey.
it's like, do you not just love honey even more now? Like, if you want to improve your tea,
I think we should eat honey on the podcast every day.
If you want to improve your tea, eat honey at this point, right?
Okay.
So DHEA is another common one out there. I'm not the biggest fan of DHEA. Well, I'm not anti-DHEA either. Certainly in certain circumstances, it could be used and quite beneficial and useful. But I have seen a number of people on DHEA whose other values and numbers, hormone-wise, start to become erratic and problematic and dysfunctional. Okay. So there you have it.
There's also creatine on here.
Yes. Creatine is a very good one. Creatine helps with your muscles especially. You know, my cross-country coach, when I was 16, 17 years old, my cross-country coach introduced, he had like he had a waiver we had to sign. He wanted to make sure that we knew the potential risks and of taking this potential supplement that he was going to introduce to us. And we're like, oh, okay, we trusted him and went with it. It was creatine. He wanted us to start trying this new supplement on the market that could help improve our performance. We did take state under his direction, so that's kind of cool. I don't know if that was directly to creatine, but hey, it was part of his plan. And
it wasn't illegal. It's not steroids. I think
Yeah.
it was more shady back in the day, but creatine does improve tea.
It can improve your testosterone, absolutely, and it does improve performance. It improves the energy delivery to the muscles themselves, to the cells, and it will help with improvement of the muscle mass.
Man, so much good stuff here. Did we leave anything out?
I don't think so. Well, a little on the longer side for us on our recent ones, but I think it was like packed with lots of good info, right?
I would agree. Where can they find you online, sir?
Well, online you can find us at chwheber.com. And you can also find Earth's Medicine Cabinet, and you can pick up some of that Lionate. It has a significant amount of the creatine in it. You can use that for energy, memory, focus, or even as a pre-workout.
This episode brought to you by Lionate. I drank a little before, and I'm feeling pretty good.
Sounds good, man.
All right, everybody. Thanks for watching.
Namaste.
Namaste.